Okay, this information is going to cover issues with anxiety. It used to be classified as anxiety disorders. So in your textbook on page 569 to 577, you're going to see them all clumped together. Some additions have been made to the DSM-5 where anxiety is classified as one category, OCD is classified as another category, and PTSD is classified as another individual category. Okay. In general, anxiety disorders, what we're starting with, they constitute with fear, worry, intrusive thoughts, physical symptoms, sweating, okay, heart beating, and maybe the feeling of tension. Everyone at some point has experienced some level of anxiety in their life. For some people, a spider or a tall ladder are enough to send chills down the spine. However, how do you know, okay, that maybe I'm very fearful of being late for school? Because that's an anxiety for me. But how does that become classified as a disorder? Okay, how does one know if they actually have an anxiety disorder? It really needs to be intense and persistent. And it also has to go along with the 3 Ds we talked about. Okay, it's dysfunctional. You're no longer showing up to work. Or you're showing up to work at 4 a.m. because you're so fearful you're going to be late. Okay, deviant, we talked a little bit about the thoughts. Something bad might happen to you, okay, because of the fear. And then the last one is distress. It's the constant panic, or it's the constant worry, or it's the constant stream of thoughts and emotions that begin to happen for you. Okay. First one we're going to talk about is generalized anxiety disorder. Generalized anxiety disorder is the physical problem characterized by persistent and pervasive feelings of anxiety without any external cause. Okay, it's not attached to a particular item or idea. Okay, so it's not like a phobia, because a phobia is attached to a specific thing you're afraid of. Generalized anxiety is something that you're just constantly running anxious on many different things. You're going to be late for school, you're not going to get a job, you're not going to get into college. These thoughts are persistent, okay, and they happen, I would say, on a continual basis throughout your day. Symptoms are common, but the persistence is not. Okay, the worry and continuously jittering, agitated, being sleep deprived, you're waking up in the middle of the night, going to study for a test, okay, leaving school early because you're exhausted. These are things that are constantly having you to change your behavior. Sigmund Freud termed it as free-floating because there was nothing specifically to pinpoint what the behavior was described as. I would know that term. It's not tagged with a specific experience. 6% of the population is diagnosed with GAD, generalized anxiety disorder. It tends to be more common in women than in men. Okay, it usually becomes evident in your early 20s. Right? Think about a lot of the changes that are taking place. You're in college potentially trying to think about a job. Okay, what job are you going to be working at? Will you find a job? Do you have college loans? Okay. Usually it's diagnosed in earlier populations, and then it tends to die down during the 50s and 60s when you're beginning to end your career. They show trends of that. Other things with generalized anxiety disorder, you may feel on edge about many of the normal aspects of life. You have excessive worry that can't be controlled. Many have a general sense of something bad is about to happen, even when there's no apparent danger. Many, you may not remember when the last time you felt relaxed or at ease. You're constantly doing something. They say that the anxiety gene can impact also the levels of serotonin. That's why often a lot of the times you may be so, you may have high levels of serotonin, which keeps you constant in the manic stage. 3 of these, if you have we did this criteria with bipolar, looking at the different elements, or depression. So if you had more than 3 of these elements circled, then that may lead you to believe that you are more possibly depressed. If you have 3 of these things that occur on a regular, hourly, daily basis, you're restless, you can't sit still, you have difficulty concentrating, you have sleep issues, you have muscle tension, you're easily exhausted. Okay, that could be signs that you may particularly have generalized anxiety disorder. Okay, panic disorder is another classification. Okay, panic disorder is a disturbance marked by a sudden and severe anxiety attacks that have no obvious connection with events in a person's life. Okay, they're usually free of anxiety between the attacks. Okay, Steve Madden is somebody in our society that has severe panic attacks. So it is often more common in women. And they recur often within a month. So you may have one in the beginning of the month, and then you have one at the end of the month, and then another one. Okay, so it is a pretty consistent pattern. Some of the things, the symptoms you may see is you see a rapid heartbeat. Okay, I've spoke to some people that says it feels like their heart is jumping out of their chest. They're sweating, they're trembling, shortness of breath, hyperventilation. You have chills, you have hot flashes, you're nauseous. You may have cramping. Okay, you have, like I said, chest pain, all right, headaches, dizziness, ability of faintness, trouble swallowing, all right, and then a sense of impending death, which can be very scary because in a sense it could feel like you're having a heart attack, can't breathe, okay, your chest is tightening up. So if this is a continuous thing, it can be something that's diagnosed as a disorder. Panic attacks at risk, people who are at risk, 1 out of every 75 Americans are at risk, and usually people who do smoke. Panic disorder many people who suffer from panic disorder also have agoraphobia, a condition which involves panic that develops when people find themselves in situations. So it's a part phobia too, as well as panic disorder. So you could have panic disorder and phobias. They are nervous around crowds, often open spaces, occurs between 2% of Americans and affects women more than men. Okay, under that classification of just anxiety, the third one I'm going to talk about is phobic disorders. In contrast with panic disorders, phobias involve persistent and irrational fear associated with a specific object. So sometimes panic attacks, there's no explanation of why they're taking place. Generalized anxiety, there's no explanation of why you're anxious. This has a specific object, activity, or anxiety that's causing you to be scared. Okay, so nervous. Okay, you're so nervous about getting on an airplane that you won't even go towards the airport. You won't even be in a conversation with somebody talking about an airplane because it makes you feel very anxious. Okay, while many of us have fears or dislikes of a specific object or situation, these can only be pathology when they have a cause for substantial disruption in your life. Okay, so yes, I may be fearful of certain objects, but when it becomes such a fear that you can't function on a normal basis, that's when it can be classified as a mental illness. Fear versus phobia. Phobia disrupts your behavior. Okay, there are many different types of specific phobias. Social phobia is when you're afraid of others. Agoraphobia, we just talked about, is you're afraid of crowds. You're afraid of entering certain fear-invoking or unfamiliar situations, kind of what I talked about, crowds. So you can have agoraphobia, which could lead to panic disorder as well. Okay, so you may have dual things going on at once. All right, here are some interesting, you don't need to know these, but I thought it was kind of interesting in terms of looking at the top 5 phobias of people in the United States. You can pause it and take a look at them, but one of them that's up there is the fear of public speaking, the fear of death, and the fear of spiders are amongst the top 3. And then it kind of goes through the list of different fears that many Americans have. Okay, so now we're going into a specific category, a different category, obsessive compulsive disorder. OCD, it's often classified as. Howie Mandel is somebody famous who has OCD. Okay, is a condition characterized by patterns of persistent unwanted thoughts. Okay, so So now you have that anxiety, but you also exhibit behaviors, which are the compulsions. So this is where it got its own category. Okay, you have the obsessive component, which consists of the thoughts, the images, and the impulses. Okay, so you have the obsessions first of all these thoughts that are reoccurring and persistent that affect a person's life. Maybe you have a concern about dirt or germs, or maybe you have a thought that something terrible is going to happen, and they continuously go in your head. Then you have the action that needs to take place. So you're fearful, the obsession is of those germs. So now you're going to do the compulsions, which is a component of repetitive, purposeful acts performed according to certain private rituals, sometimes they're called, in response to the obsession. So maybe you're going to wash your hands and you have to count in order to get that obsession out of your head. You have to check your lockers, check your folders, check the lights, check your homework. And it becomes a problem when you no longer can function and do your daily activities in a pretty quick, efficient manner. Okay? I think a lot of us are a little bit OCD. Okay? When they are calm, people with obsessive compulsive disorder view their compulsions as senseless. However, when anxiety arises, they cannot resist from performing the compulsions behavioral rituals to relieve the tension. So when they're not thinking about it, it's like, oh my gosh, why do I do that? That's so silly. But when they're in the act, it's like they cannot move on from their daily task until they do those rituals. OCD has a tendency to run in families. There's a clear genetic connection. But it's also environment seems to play a factor. Behavioral therapy, which we'll talk about next week, is a great tool to help people that suffer with OCD. Okay, so here's kind of the cycle of what takes place. You have your obsession. The obsession can be triggered by an environmental event. Okay, and then you have the thoughts, the anxiety. Okay, with the that comes with the thoughts, and then you have your compulsions, which are the actions. And then you have a sense of short relief. Okay, and then something can trigger the obsessions to occur. Then you have that anxious gut feeling, and then you got to get rid of those anxious feelings and those compulsions, or those obsessions, so you're going to do the compulsions, and then you have a bit of a relief. Alright, and then the last category we're going to talk about, and we've talked about it a lot throughout the semester, but post-traumatic stress disorder, PTSD. Okay, post-traumatic stress disorder dates back to 6 BC, where reports on the battlefield stress had adverse effects on soldiers. Okay, in the past, PTSD had been referred to as railway spine, shell shock, okay, battle fatigue, traumatic war neurosis, or post-traumatic stress syndrome. Today, treatment involves therapy and anti-anxiety drugs, so they do both. During World War I, treatment looked much different, and they did do shell shock therapy, which is something we'll talk about again next week. But now they do a lot of PTSD therapy. Okay, so post-traumatic stress disorder, 4 or more weeks of the following symptoms constitute with PTSD. You have haunting memories, nightmares and flashbacks, socially withdrawn, okay, jumpy and anxiety, and sleepless. I know we talk a lot about post-trauma in terms of war, but post-trauma can be a result as a terrible car accident. It can be a result as a stabbing, a raping. It could be anything that's post-trauma that's going to cause you to have haunting memories, flashbacks, social anxiety. Okay, and do you have to have all of these? No, maybe you're just really jumpy and socially withdrawn. Okay, so it's kind of, these are some of the symptoms that you may display. Bearing the stressors of war, here's kind of an interesting statistic. More than 2,000 Army soldiers who served in Iraq or Afghanistan have been diagnosed with post-traumatic stress disorder. You can see as of since 2003, and you can see as of 2007, the numbers are also going up. And this is from the Associated Office of the Surgeon General. Navy and Air Force are kind of low. Marines, they have a lower amount of men maybe that are in those positions. Okay, and then Army maybe has a larger force, but they are the larger people that are getting diagnosed with PTSD. And a large percentage of them may be going undiagnosed as well. resilience to PTSD and some statistics. About 10% of women and 20% of men react to traumatic situations and develop PTSD. 1 in 6 U.S. combat infantry report symptoms from Iraq, okay, and 1 in 4 reported from symptoms from Afghanistan. So maybe you're looking at Afghanistan is a more stressful or high anxiety environment, or maybe there was more trauma that occurred there. The greater the emotional distress during trauma, the higher the changes and the chances for PTSD. So if there's more trauma, and the more severe the trauma, the higher the chances that you may be facing PTSD. PTSD was double for victims inside the building of 9/11 than outside survivors. So the survivors that were actually inside faced more trauma, okay, than the people outside, so they saw a rise more in the people that were actually in the buildings. Debriefing, they say, right after the event can be harmful and carry out the trauma. So they say to let the person kind of have some time to process the thoughts before you start working through the thoughts. Usually the cause for PTSD is the experiences. Okay, resiliency is a big thing that they looked at. What causes certain people to bounce back quickly? How come certain people may be in a trauma, such as, they were in the concentration camps and they didn't experience PTSD. They say that people that have really strong support systems, okay, and are knowledgeable of self-awareness and who they are and the experiences that they're going through, have an ability to bounce back quicker. So going through the therapy process, becoming aware that you have certain symptoms, becoming aware that you have supports. What are your strengths? Okay, PTSD leads to self-discovery and personal strength. So when they're actually going through this process of understanding who they are, they have a better personal strength and appreciation for life. Yes, I faced this trauma. Okay, yes, I lost a child. Okay, but now I appreciate the life that I'm going to now live, and I'm going to take every day. I'm not going to take it for granted. Some of the things that may cause anxiety disorders, OCD, is things with learning. Okay, you can be classically conditioned to be fearful of certain things. You could also be operantly conditioned to be fearful of certain things. Classical conditioning, we saw the perfect example of little Albert became fearful of rats or white animals. Operant conditioning, okay, you can be rewarded or punished, okay, which can cause you to have fears, right? And then social learning, your mom goes, and because she saw a spider, and now all of a sudden you're watching her and you're understanding that she's scared of them, so now you become scared of them. Biologically, you could also have a sense of anxiety or fear. You could be predisposed as a really strong temperament, that may be nervous or anxious. Okay, anxiety gene impacts, like I said, the levels of serotonin. And then too much glutamate in the brain can also cause you to be overactive. Other things that you should know from this unit that wasn't really covered in the book, but there's also developmental disorders, a different category. It's usually the first one that's mentioned in the DSM-5. This can be developmental disorders are grouped by disorders that can appear at any age, but most often show signs during childhood. And it is often due to something in terms of their developmental process. So autism is the first one. Autism is marked by the disability in language, social interaction, and the inability to understand another person's state of mind. Okay, so that's a general definition for autism. 1 in 500 children have been diagnosed with autism, but I know that statistic may have changed. Okay, ADHD, you've probably heard about. Attention deficit hyperactivity disorder. It's the inability to focus and attention. You're often hyperactive and you're impulsive. You can't maintain a focus. So again, that's a very broad definition. And then dyslexia you may see, which is a reading disorder where letters and words and numbers are perceived out of order, upside down, or completely incomprehensible. Okay? And so, again, these are things that we can talk about more after the AP exam is over. They may be mentioned on the AP exam, so I do like to bring it into light. Okay, so eating disorders, I know we also talked about in the motivation unit, but of the two eating disorders that exist, you should also be aware of anorexia nervosa, an eating disorder that causes a persistent loss of appetite that endangers an individual's health, where an individual just does not eat. Okay, and they could exercise a lot to help them lose weight as well. They have a false image of themselves, as you can kind of see in this picture, okay, which is deviant thoughts that maybe are potentially misattributing. It stems from a lot of the times from emotional and psychological reasons versus a biological factor. It usually distorts the view of oneself, and 1% of the population is usually impacted by anorexia, which is higher than bulimia. Bulimia nervosa is an eating disorder characterized by binging and purging. It induces vomiting, so it causes you to throw up, and it also, people use laxatives to help them go to the bathroom right after they eat. 0.6% of the population is affected by bulimia. Okay, they did change the criteria in the DSM-5 now. 12 episodes of vomiting within a 3-month period could classify one as having bulimia. Prevalence of mental disorders. So looking at all the different mental disorders which we've looked at, here's kind of an interesting chart in terms of how many, what is the rate of being diagnosed with specific disorders. A high one on there is specific phobias. Okay, so in major depression is another higher disorder that's usually diagnosed. Okay, post-traumatic stress disorder, another high one. All right, versus obsessive compulsive and Alzheimer's, they're on the lower end of the scale. Schizophrenia would probably also be on that 1% portion of the scale as well. Do you need to know this? No, in terms of for the test, but it's just kind of an interesting chart. Another fact that I don't think I pointed out, but schizophrenia is a disorder that's usually found everywhere around the world. Some disorders are low percentage in terms of they're highly recognized in certain parts of the world, but this is the one. If you had to look at schizophrenia, they find schizophrenia in any culture around the world. Dilemmas with diagnosing, I kind of spit this out at you the other day. Dilemmas, problems with diagnosing, people are labeled as different, stereotypes can occur, and sometimes people are overdiagnosed. They have a name for it now, so let's start diagnosing people with it. Okay, people also might not look at the opportunities of life now because they're labeled as maybe seeing not good enough. We talked a lot about the stigma of labeling. Benefits, it gives people an answer for their behaviors. It allows people to look at similar cases. Mom now is researching this and helping other parents, and allows doctors to the knowledge of what might help them, since now they have other patients to look at. Okay, so thoughts for the quiz. These are some of the lists of what you should know for Friday. You should know the history of mental illness, and you should understand what the medical model is. You should understand what the DSM-5 manual is. Stigma of mental illness, the pros and cons of labeling. You should have a pretty good idea of the symptoms and the criteria for schizophrenia, depression and bipolar, somatoform disorder, dissociative disorders, dissociative fatigue, and dissociative identity. You should have an idea of the different anxieties, okay, generalized anxiety disorder, phobias, and panic. You should also have an idea of OCD and post-traumatic stress disorder. I did just talk about some developmental disorders, eating disorders, and personality disorders. Okay, so avoidance, schizoid, the 8 different classifications we looked at. Some of this information you're purely responsible on your own. Majority of the information we have covered as a class.